Hello, everyone. Good evening, everybody. I'm Riddhi from Bladder Wellness Team. I'm sure all of you must be keeping good in health. Today, we are going to discuss a very important topic that is benign prostatic hyperplasia, which is also known as BPH. BPH is the non-cancerous enlargement of the prostate, usually begin in 50s in men and in which many men may cause obstruction to urine flow. Many men have to get up and go to the toilet at night and is the most troublesome aspect of this condition as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events such as theater or cinema rather difficult. A doctor such as urologist can treat this condition and help the patient to get relief. To throw more light on the subject and guide us what's right for the diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Venkat Reddy, MS, MCH, Urology. He has a rich experience of 8 plus years and hands on expertise in management of urinary calculi, stricture, urethra, prostate, and andrology. He has worked at some elite hospitals and currently working at Miryalguda Kidney Center, Miryalguda. Dr. Venkat Reddy has rich experience in the field of urology and carries out the diagnosis and treatment with utmost precision and efficiency, ensuring that patients' health is in safe hands. Hello, doctor. We'll start with this, and we have first question with you. What is BPH?
Yeah, good evening. My name is Dr. Venkat Reddy. I'm an urologist. I did my MCH urology from SWIMS Tirupati, and later I worked in Hyderabad in some hospitals. And later, right now, I'm practicing in miryalguda as a urologist, consultant urologist. Your question is, what is BPH? BPH is benign prostatic hyperplasia of the prostate. It is a non-cancerous condition. It generally starts after the age of 50 years. Means sometimes we may see after 40 years also, but it's very rare to see below 40 years. And it generally starts after 50 years, and slowly the symptoms may progress, and the symptoms sometimes be troublesome, and that might lead to some urinary obstruction also in some patients. Yeah, next.
What causes BPH?
BPH. As such, there is no particular cause for benign prostatic hyperplasia of the prostate. There is no particular cause. But age is a factor. Sometimes when the patients cross the 50 years, 50 years or as the age increases, the chance of getting prostate is more. And a normal prostate means normal hormone, testicular hormones, and is a must for prostate to become hyperplasia. Recently, some scientific studies are saying diabetes and heart diseases also as a risk factors for prostate. Yeah.
Thank you. What are the symptoms associated with BPH?
Generally, benign prostatic hyperplasia, the symptoms will be irritative and obstructive. Means if you see the patient complaint of frequent urination, the patient complains of frequent urination every hourly or daytime, the patient may sometimes complain of 10 to 15 times of urination. And some patients may complain of nocturnal frequency also. Nighttime also the patients tells us, sir, I have to get up every hourly, 2 hourly, it's disturbing my sleep.
Hmm.
So frequency is the main thing that is, will cause troublesome to the patient. And some patients there will be difficult to start micturition, difficult to start pee, means difficult to start the urination. And some people will complain of dribbling of urine. At the end of the micturition, the post micturition dribbling, some people will complain, sir, I'm passing some drops of urine at the end of micturition. Some people will complain. And some people will complain of start and stop. They start the urination, they will tell, sir, while I'm urinating, the urine is stopping suddenly and it's starting. Stop and start. Some people may complain. And some patients may complain of complete retention also. Complete retention means not able to urinate. Or some people, some patients will complain like that. sir, after passing urine also, I am feeling that some urine is left in my bladder.
Hmm.
Some urine is in my bladder. I am not passing all the urine.
Urine.
And sometimes, very rarely, we may see blood in urine also.
Hmm.
So these are the general symptoms. Some people will complain of urgency. Urgency means they want to go to urine, they have
Immediate.
to go urgency to there. Or urge incontinency. Because of urgency, they may pass some amount of urine. Some urge incontinency. Incontinency means the patient lost is what do you say? Without his knowing, he will pass some urine. Urge incontinency. Urgency is also a symptom.
Hmm.
Yeah.
What are the most and the major troublesome symptoms faced by the patient?
Troublesome. Yeah, coming to troublesome, the symptoms will be some mild, moderate, okay.
Hmm.
Sometimes the patient complains about most troublesome means patient says that, sir, I have to urinate, I have to wake up night every 10 to 15 times. So that will disturb his sleep. Okay, the disturb his sleep, number one. Number two, sometimes there will be complete urinary retention, means not able to pass any bit of urine also. This is also the most serious. And
Hmm.
sometimes there will be blood in urine.
Hmm.
We may see the patients may see blood in urine, or sometimes there will be what do you say? Some patients may develop bladder calculi also,
Hmm.
bladder calculi, and large volumes of post-void urine, post-micturition or post-void urine will be there, and infections, urinary infections. These are the serious complications we see of prostate.
Thank you, doctor. Doctor, what should be included in the history and physical examination in men with symptoms suggesting BPH?
Okay, history and physical examination. Okay, coming to history, we generally ask whether there previously any parents or grandfather or father suffered from prostate.
Hmm.
Generally, if the parents or his father or what you say his grandparents suffer from prostate, there is chance of getting the prostate benign prostatic hyperplasia is more in that patient's family history.
Hmm.
And to physical examination, we do a small general genital examination. We do, and we do a digital rectal examination. We
Hmm.
see digital rectal examination. We'll find the consistency and size of the prostate.
Hmm.
These are
Uh,
the
you mean to say most probably it can be caused and found in the men's which are genetic, and some with the proper miscarriages not being hygiene or anything may cause BPH at the age of 50.
sorry, hygiene is nowhere related. Some
Okay.
people, family history may chance is there, but hygiene is nowhere related to this BPH.
Okay. Doctor, what are the severity of BPH?
Uh, I didn't got your question. Please repeat.
What is the severity of BPH?
Severity. Yeah. Coming to severity, some patients, hello,
Doctor.
yeah. Coming to the severity, generally, some patients uh, may the patient may go to complete urinary retention. Means the patient will not able to pass urine. Number one, severity. Number two, there will be a bilateral hydronephrosis. Both the kidneys will swell up because the urine doesn't pass.
Hmm.
And some patients may develop bladder calculi also, and some patients may develop recurrent urinary tract infections also. Okay, these are the severity we will see.
Doctor,
Yeah,
what are the measures to be taken, and when should one visit a doctor, a urologist?
yeah. Coming, if symptoms are mild and is not bothersome to the patient,
Hmm.
uh, just leave it.
Hmm.
Okay, when symptoms are bothersome, if they are bothering the symptoms,
Hmm.
we should visit a urologist.
Hmm. What tests are recommended in men with symptoms suggesting BPH?
Yeah, generally when a patient approaches, we take the history and physical examination. We do
Hmm.
a digital rectal examination, and we'll find the shape and size, consistency, and we'll know the consistency of the prostate. And we generally do an ultrasonography of the
Hmm.
abdomen,
Hmm.
ultrasound of abdomen to know the prostate size and post-void urine. Okay, and we do some blood urea creatinine test to
Hmm.
know the renal function and a complete urine examination and complete urine analysis and a urine culture also will do and uroflowmetry in order to know the flow rate, in order to know the flow rate, because some patients complains of poor
Yes.
flow. So we do a uroflowmetry in the patients to know the flow rate.
Hmm.
So in a synopsis, we do ultrasound abdomen and uroflowmetry and blood urea creatinine.
Hmm.
Yeah.
How should BPH severity managed?
Yeah, coming to PPS severity, coming to the severe, if there are symptoms of severe,
Hmm.
means large post-void urines,
Hmm.
post-void urine volumes, and recurrent UTIs, and if the patient has bladder calculi and have bilateral hydronephrosis and acute urinary retention,
Hmm.
the patient can be categorized and go for surgeries,
Hmm.
and they should go for surgery. Yeah.
Okay. When should one start taking treatment for BPH?
Yeah, coming to treatment, as previously I said, if the mild symptoms, leave it. If the
Hmm.
symptoms moderate, generally we start medical treatment. Medical treatments are there. So many drugs are there, like
Hmm.
5-alpha reductase inhibitors and alpha blockers are there. We combine, or we give monotherapy, or we combine 5-alpha reductase inhibitors with
Hmm.
alpha blockers as a medical treatment, and we'll observe. If the symptoms subside, we leave it. We'll start medical treatment only. If the symptoms doesn't subside, we may go for minimal invasive treatment. Also is there for the prostate. Minimally invasive, like tulip, and holep. The minimally invasive treatments are there.
Hmm. Doctor, how many medical treatments are available for BPH? Medications or surgeries or therapies? What is best for any individual suggesting for BPH?
First, we'll go for medical treatment.
Hmm.
Number one, that's very simple. Daily at bedtime, we have to take a tablet.
Hmm.
That's it will suffice in some patients. The patient's symptoms will decrease. Okay, we leave it. Next,
Hmm.
coming minimally invasive treatment are there. Sometimes we can do as a daycare procedures also, like tulip, polep,
Hmm.
Polium late increase of the prostate,
Yeah.
tulip. These are the minimally invasive treatments. If it is totally obstructing the gland, the prostate gland is totally obstructing the patient presents with acute urinary retention, then we may go QR, means transurethral resection of the prostate. Surgery also will go. This all depends on the symptoms and severity.
Okay.
The treatment,
What are the long-term risks of BPH?
as such, long-term risks. If the BPH, yeah, coming to long-term risks or complications, you can go for complications. We
Hmm.
can say what are complications of BPH on a long-term basis. The
Hmm.
patient recurrent urinary tract. Hello,
Yeah.
uh, I'm getting it. I'll take that 1 minute.
Yeah. So all the viewers are requested, if you have any such questions related to BPH which you are facing right now, you can write us down right now. We are going live. We are connected with the doctors, and that is all. We can have major information from doctors, as a doctor has removed the valuable time for all our viewers to let them know that what is the main purpose of this live session, so that we get a lot of information from the doctor through this YouTube streaming. And it is very important for all the men who are connected right now. Whatever questions, whatever you are facing right now, if the treatment, you're visiting a urologist, and there are a lot of things you need to know more than having a treatment, or should have a surgery, or you want to have a alternative suggestions. So we have a doctor with us giving us a lot of suggestions and informations. We will be asking much more questions with him. He'll be joining us. Till then, let me have a minute, and you get a 1 minute over there. You can just quickly write down all the questions you want to ask our Dr. Venkat Reddy. Yes, I seem to have, there are like lot of questions being coming up in my chat.
Sorry.
And yes, doctor is back. So yes, doctor, we were at a question where what are the long-term risks of BPH?
Yeah, a very good question. What are the long-term risk, or we can say complications also, if it is not treated well. The patient suffers recurrent urinary tract infections, number one. Then some patients may develop bladder calculi, and some patients may develop bilateral hydronephrosis because both the ureters and the kidneys may swell up. And some patients may complaints of blood in urine, hematuria also. In some patients, they may complain of total blockage of urine, complete urinary retentions. Hello?
Doctor, what are the treatments after treatments? What major care should be taken by the patients?
Uh, mm, uh, 1 minute. My camera is not getting. You're not seeing, no, my camera. Can you see me? Can you see me? Hello?
Yeah, doctor, tell me.
Yeah. Ah, okay, okay.
Yeah.
Please repeat the question. Repeat the question.
Doctor, there are a lot of patients who go under surgery. So after treatment, what major care should be taken by the patients?
Okay. Post surgery, there is no means. Every 4 months or 5 months, they should get an ultrasound abdomen and an uroflowmetry, and they consult their urologist, operative surgeon. And every 6 months, means 5 to 6 months, we do an ultrasound and a uroflowmetry to see whether the flow rate is good enough. There is a two things. There is no special care as such.
Okay.
Yeah.
After the completion of treatment, is there any chances one can get again diagnosed with BPH?
Yeah, definitely. Some patients will complain, sir, I underwent surgery 5 years, 6 years back. Again, I'm getting the symptoms, recurring the symptoms. Definitely, there is a chance. There is a chance that prostate can again enlarge after surgery. In some patients, we may see there is again growth of the gland and causing the symptoms also.
What are the effects if not treated BPH on time?
Yeah, on time. As we discussed previously, if you don't treat them on time, the most important is the symptoms will be bothersome, as we discussed in nighttime frequency, which is causing sleep disturbances, and it will cause some lifestyle what you say problems also to the patient. And if we don't treat them with, as we said, recurrent infections, the patient get recurrent infections, bladder stones, and blood in urine, and in bilateral hydronephrosis. That means the kidneys may damage, and in some patients there will be total obstruction to the urine. That is acute urinary retention also.
Doctor, which are the medical therapies which are effective in management of BPH?
Yeah, generally medical treatment, we write one or two combination drugs. Generally alpha blockers. We write tamsulosin 0.4 mg. We tell them to take at bedtime, or a combination therapy with combination with an combining with an alpha reductase inhibitors like tamsulosin with dutasteride at bedtime. We ask to take that tablet at same time at night time before sleeping, half an hour before sleeping. We used to tell the patient to take the drug for a period of 6 to 9 months. Generally, we'll tell to take the same tablet from 6 to 9 months.
Uh, Doctor, which are the patients referred for surgery and which are the patients referred for medications and therapies?
Yeah, we previously said if the symptoms are mild, they're not bothersome, we'll tell the patient leave it. Just observation. Number two, if the symptoms are troublesome, then we'll go for medical treatment. This medical treatment, and we observe the patient, and we'll review the patient, and we'll say the symptoms are subsiding, and then we'll leave it.
Okay.
The patients which we refer for surgery are definitely are a failed trial wording in a patient. Failed trial wording in a patient, that is acute urinary retention, number one. And there is a large volumes of post-void urines, which cause recurrent urinary infections, bilateral hydronephrosis, and bladder stones, means upper tract changes. because of this lower tract obstruction. In these cases, we advise them surgery.
Doctor, is operation open or endoscopic?
Yeah, this surgery generally nowadays we are doing only endoscopic surgery. That is called transurethral resection of the prostate. This is a endoscopic procedure. Previously, we used to do open surgeries like open prostatectomies.
Doctor, is BPH connected to other diseases also? If the person is having obesity or diabetic patients, their chances are the higher risk of BPH.
Yeah, previously discussed, no, the obese patients has more chance to get BPH and
Hmm.
diabetes also. In some studies, it's in the diabetes and heart disease are somehow related to the benign prostatic hyperplasia.
Hmm.
Yeah.
Okay, thank you, doctor. And we have a lot of viewers coming up with a lot of questions. Your session has been very informative, and we have viewers with a lot of questions. So we'll go with the first question. We have Swapnil with us, whose question is he wanted to know, can diabetes contribute to BPH?
Yes, has previously said,
Hmm.
some scientific studies
Hmm.
has shown that people with diabetes has more chance of getting benign prostatic hyperplasia than who don't have.
We have Suresh with us asking, does BPH affect kidney health?
Definitely, BPH affects kidney health. If it is a long standing, if it is not getting proper treatment,
Yeah.
there will be long term obstruction which may cause bilateral hydronephrosis of both the kidneys, recurrent urinary infections which may cause a kidney scarring, and a loss of the kidney function.
Mhm. As you mentioned, but I seem to have viewers with the same question, like, can BPH affect their sleep? That's Ankit's question.
BPH affects sleep.
Yeah.
Yes, definitely BPH affects sleep. If the patient has nocturnal frequency, that means some patients may complain that I am going to urinate for frequency of 10 to 15 times, 15 episodes a night, then definitely it will disturb the sleep and the overall health of the patient also.
Doctor, we have Rishi with us. Are there any medications that can help with BPH, like prior precautions to be taken care to avoid BPH in future?
There's no, we can't prevent, means what is it? There's no preventive things. If the
Hmm.
symptoms are mild, as we previously said, symptoms are mild, leave it.
Hmm.
If symptoms are moderate, then we give prescribe, and as you previously said, like alpha blockers with 5 alpha reductase inhibitors. We ask the patient to take for 5 to 6 months or 9 months.
We have also Bharat Mishra, whose question is, can BPH worsen existing kidney problems or lead to new kidney issues?
uh, Definitely BPH, because this BPH is causing, means large volumes of postward urine will be there in some patients, large volumes of postward urine, and which in turn get infected. The patient will get recurrent urinary tract infections, and both the upper tracts we may see in the meantime loss of function also, kidney function also there. Because of this recurrent urinary tract infections, loss of kidney function also we will see in some patients.
Doctor, we have Manoharan, whose question is, what kind of food habits one should follow for prostate health?
Yeah, generally with the lifestyle modifications coming to, we ask them to take moderate, not too much of non-veg. I usually prescribe, tell to my patients not to take more of red meat. Okay, red meat. Don't take more red meat, and mm, generally we can take that. That's the only advice I give to them. Generally, general advice is. Otherwise, there's no specific diet things is there. I ask them to take more of fruits and vegetables,
Hmm.
and I tell them not to take more of red meat. Okay, and I'll tell them to take whole cereals like millets, okay, quinoa, brown rice. I tell them to take and maintain what to say, like diabetic diet only. I prescribe them diabetic diet like that. As such, there is no diet that this diet will cause BPH or like that. There is no strict things are not there.
What are the side effects of having more red meat? If person likes more of red meat, they don't avoid it, but they keep having it after being a urologist suggesting not to have red meat, but still they have it. So, what are the side effects the one patient of BPH can have?
Generally, why is that? Because the red meat doesn't cause prostate hyperplasia also. As a general, as a heart line, heart guidelines, the food for proper heart. Generally, I tell that if you take more red meat, the patient may develop calculi, renal calculi, number one. Okay, and the patient may develop what is say altered is lipid profile. It may cause what is say uh, cardiac heart disease also. Okay, and heart disease also. In general, we tell them like that. As such, there is no food. This food is causing BPH, and we don't. There's no food, guidelines are not there. Strict guidelines are not there.
Okay. Okay, so that is your personal experience that having lesser meat can
Yeah.
avoid BPH at higher risk. Okay. All right. Thank you. We have one more question that Navodeep, can BPH cause erectile dysfunction or other sexual problems?
No, 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 no. No, BPH never cause erectile dysfunction or any sexual dysfunction. They will have normal sexual life.
Okay. We have Rohan as a viewer and has a question. Can BPH affect his mental health or contribute to symptoms like anxiety or depression?
Yeah, yeah. Some people, if the symptoms are bothersome, okay, very severe symptoms are uh, very severe means like a frequency, nocturnal frequency means every hour he has to get up. That will disturb his sleep. Okay, when his sleep is disturbed, the patient's overall health will also be disturbed. The patient may feel anxiety and everything. In
Hmm.
that, it might affect his. He may get anxiety and that's the thing I generally observe in my patients.
Doctor, it seemed to have like at the age of 40 to 45, all men should get themselves treated or tested for BPH.
No, no. Generally I don't advise that like that. I generally advise after 50. You just after 50, not 40, 45. After 50, if you have any symptoms, as we discuss, like frequency, urgency, poor flow, and dribbling of urine, post micturition dribbling, and stop and start, and difficult to start urinate. These are the five symptoms. If you see these symptoms in your life, you approach a urologist, consult a urologist, and get an ultrasound abdomen and uroflowmetry as a basic
Yes.
thing, and your urologist will do the rest of the things for you.
Okay. All right. So we have Adi with us having a questions. Can BPH affect his urinary incontinence or lead to bladder control issues?
Yeah, as we discussed, BPH it will have irritative and obstructive LUTs, means lower urinary tract symptoms. Like irritative LUTs means urgency. Urgency. The patient want to pass. If we get the idea to urinate, he should pass. That urgency will be there. The meantime, when you find the place to urinate, the bathroom, sometimes the patient will may incontinency also will be there. That is called urge incontinency. Urgency with incontinency. Yeah.
Doctor, what is prostate?
Yeah, prostate is a normal male reproductive gland. Uh, Generally, yeah, what you say, it is a walnut. Yeah, we see walnut. No, walnut.
Wallet.
Sometimes pear shape, pear shape. It is a shape and size of that. It's normally weighs 20 grams, like 20, 25 grams. It's normally it is the 20 grams. It's a male reproductive organ, and it generally presents just below the bladder, in front of the rectum, and it surrounds the tube-like structure, that is urethra. It surrounds the urethra. Means the urethra means there is a structure which pass to the penis, which from which we urinate.
Can prostate lead to cancer? What is prostate cancer?
Yeah, these prostate cancers we see in some patients after 60 or like that 60, 65 years. In some patients, we may see prostate cancer. It is a cancerous means condition in which there will be uh, cancerous condition. Means benign means what is BPH? It is a benign prostatic hyperplasia. In this, there is no non-cancers. In some patients, they may convert into cancer also, prostate cancer. That which we identified by doing a serum prostate specific antigen test in that patient.
Yes. Yes, we have a viewer Rahul Sharma with us whose question is, and also Santosh, is drinking a lot of water good for prostate patient?
No. What drinking, what consuming water is nowhere related to BPH.
Mhm. Like his question is like drinking more of water as a capacity, as all the doctors suggest that you should have at least 4 liters of water a day for a healthy lifestyle. So having and consuming more of water can lead to like is it good for prostate?
You drink more water, it's good for your overall health and prostate.
Mhm.
But drinking more water or less water is nowhere related to prostate. Drink water. 4 to 5 liters is good for your overall health,
Yes.
overall kidney and prostate.
Mhm. Doctor, we have a question from Wasim as well. What is the most effective treatment for BPH?
The most effective treatment nowadays, medical treatment is the first line treatment. We'll go for medical treatment. A single tablet at bedtime at the same time every day that will address the most of the patient's complaints. Yeah.
Doctor, thank you so much for giving some beautiful advices and valuable time. Doctor, what advices would you like to give all the men who are not suffering from BPH and might hit the age of 50, and the persons who are actually being diagnosed BPH? What advices would you like to give?
Basically, if the for the population, for the men who cross their 50,
Hmm.
if you have any symptoms, 5 symptoms, I said,
Hmm.
the frequency, urgency,
Hmm.
difficult starting urinating, stop and start of urinating, poor flow, if they have these symptoms, consult your urologist and get an ultrasound and uroperimetry done.
Hmm.
And that at the earlier stage, we will detect your BPH and we'll start the medical treatment. And the patients who are diagnosed to have BPH,
Hmm.
my suggestion is strict compliance to your treatment. Strict compliance means take the drug at the same time of the day and be compliant with your medical treatment. Yeah.
Thank you so much, Dr. Venkat Reddy, for your valuable time. And it has been a very quite informative session for all our viewers. We look forward for many more such sessions in coming time. Thank you, viewers, for your excellent participation. For more information and update, stay connected with our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you so much. Have a great day ahead and take care of yourself.